Good afternoon. My name is Holly Dinnany, and I am welcoming you to our weekly Lunch and Learn program. It's a weekly educational event hosted by family partners of Morris and Sussex County. The concept of our event is that we're giving you lunch with an expert. So we know that this is the lunch hour. If people would like to keep their cameras off because they're either nibbling or sipping on soup, we understand that. But we love to see smiling faces when you're able to do that. So keep in mind, this is your event, this is your program, and our speaker is here to really give you the information that you need to stay healthy and informed and to obviously forward your information or your knowledge on a certain topic. So I am recording today's session. Laura Stanzilis, our speaker, has given us permission to do that, which means we will be sharing it with you afterwards. We do send up follow-up information, so you don't have to go crazy taking notes. If you don't like, we send up a little bit of follow information. We will send you a video, a copy of the video. And I would encourage you, as the presentation is going on, to feel free to utilize the chat function. If there's a question, if there's a comment that you would like to share, please feel free to do so. And without further ado, I am going to introduce our speaker today is a woman who wears many hats, which I find fascinating. She is the executive director of the North Jersey Health Collaborative. Did I say that correctly,
Yes,
Laura?
you did.
And
Yes, you did.
she's a nurse. She's been a fitness instructor. She has really just had her hand in health and wellness for a really long time. And Laura and I were having a conversation recently. Actually, we were in a meeting earlier today, just talking about how providers and the community can work together better to provide services to families who need services. So of course, that's very much in line with what Family Partners is all about. We try to connect folks to resources that are available. And last week on our Lunch and Learn, we had a really interesting conversation with Norwest Cap, who was talking about, they did a case study on families who on a family who had a lot of needs, who were complicated by the pandemic. And she had an unusual situation where they kind of brought some people to the table, educators and trainers to the table. And it was a really awesome story because it was empowering. And it was an example, I think, of how we need to do a better job of sharing notes and sharing what we do. So I know, Laura, that's a lot of what you're about with the collaborative, is sharing resources and connecting people and building relationships moving towards that goal. So we're thrilled to have you here today. So if I've left anything out from your, you've also author of 2 books. That was the other thing, author of 2 books, and one of which I loved. The title is, well, what are you waiting for? A self-health care guide. So I really welcome you here today and look forward to what you have to share with us, because you said oftentimes leaders and caregivers don't take care of themselves. Is that correct?
That is absolutely correct. Yes.
So you're going to help us with that today.
I certainly am. I mean, we always put ourselves last, whether we're a parent, a caregiver, a leader in an organization, a volunteer in a community where we live to serve, but in service of others, we sometimes forget ourselves and our own needs. A little more about my background. I became a nurse because I was a fitness columnist for the Morris County Daily Record. I share that because this is Morris and Sussex. Um, I was working in various gyms teaching strength training and yoga and cardio exercise, and I started a newsletter for my class members. And my mother, I love this story because, mothers believe so much in us. My mother said to me, you should have your own newspaper column. And I said, well, from your lips to God's ears. So she said, seriously. So I said, okay, you know what I'll do? I called up the Morris County Daily Record, and I thought I was talking to an intern because he just sounded very young. And I said, well, I read a newsletter, and I noticed that the Daily Record doesn't have any kind of health and wellness or fitness column. And I love writing because my degree, my BA is in theater and communications before I became a nurse. So I've got a passion for creative expression. Not unlike my colleague Lois here, who's a dancer, now fitness instructor, business owner. And I said, how can I get one of my articles to your boss? And he said, well, let's start by sending it to me because I am the boss. So I set up a meeting with them, and they asked me, the editors asked me to bring them 6 weeks worth of material. So I showed up with 6 weeks worth of material, And they gave me my own column every Tuesday, Keeping Fit with Laura O'Reilly. It says Stanzillis on here, but I'm Laura O'Reilly Stanzillis. So it was Keeping Fit with Laura O'Reilly. And I wrote for 4 years, every 52 weeks for 4 years. So that's over 200 plus articles, which became the content for my first book, Get Fit to Go. And after I wrote a million times on how many ways you could do a squat or a chest press, I started venturing out into the disease process and how to prevent chronic disease. And then just one day, again, Morris County centric, I just decided to go to the registrar's office at the County College of Morris. And I said, how do I get into the nursing program? And they sent me to the nursing department, and there happened to be a spot in the weekend nursing program in advance. They said, do anatomy and phys and your chemistry, and we'll get you in. So that's how I came into nursing. And I like to share that because my long breadth of experience background is in fitness. And then I came into nursing from fitness. So I did work a little bit in the clinical setting. I worked a lot in community health, doing screenings. And now I lead a collaborative of individuals like yourselves who are working in nonprofit in fitness and wellness and healthcare. So with that said, I bring a lot of experience of tried and true methods of optimizing our health to the table. And that is my lead into my slideshow so that we can have something to focus on as I speak. Bear with me. Oh, I need to be able to share the screen, right? Okay, share the screen. And here we go. So I am calling this presentation Maximizing Well-Being and Caring for the Caregiver. I'm trying to move the toolbar from the top so I can get on my slideshow. And as you record this, I'm going to assume that you can see all of these changes I'm going through with my screen, right?
Yep.
But that's okay, because I always like to say that life, like yoga, is a practice, not a performance, right? So this is all in real time. So my goal in my life's work is to help people to create healthy outcomes. And in order to create healthy outcomes, we must take self-responsibility for our health and our health care. All of us working in nonprofit, working in the community, running our business, we have a mission, and we are driven to wake up every day and support programs, individuals, departments, clients. But our mission to improve the lives of others must start with ourselves. What is that old analogy? You know, if you're on an airplane and you need oxygen, you put it on yourself first before you can attend to others, right?
Love
You
it.
must fortify yourself so that you could be the rock for others. Because if we don't take care of ourselves and we ultimately suffer disease, fatigue, burnout, then we're really not only of no use to ourselves, we're of no use to others. And that's kind of counterproductive, right? I'm going to start with the elephant in the room, and that is COVID, right? We are living in a very unique situation. We are living in the first pandemic pretty much of our lifetimes. And there's a lot of information and misinformation out there. So what I would like to encourage everybody to do is, when planning for yourself and your families and your clients, go to sites where there is evidence-based information, not the news, not the fake news, not Facebook, unless it comes from a reliable source. I always tell people, when you're looking up something, go to, .gov.edu, right? So the state of New Jersey Department of Health website has very reliable resources. The Morris County Division of Public Health, you can get a link to them in Morris County right from the Morris County Commissioner's webpage. So you go to morriscounty.gov, there's a link right to public health. If you go to the Sussex County, New Jersey Division of Health, you will get live real-time information from the health professionals in your county. I also encourage everybody, if you have any questions about immunizations, COVID testing, contact tracing, the entire process related to COVID, or anything you want to learn about the virus itself, you can always go to your local office of public health, your board of health, your board of health administrator in your municipality. So one of the things when talking about, making a checklist and self-care is to understand who your resources are and where to go and what to do when you need them. So again, .gov, health department, county health office, your local office of public health is your best source of information for coronavirus. Okay, so new share. I have to do a new share because my screen sharing is paused.
Okay.
So that's okay. We're
All
again,
good.
all good.
That's the gift of Zoom, isn't it? The patience
Yes.
is a whole new level.
Well, here's the other thing. One of the things that's very important for all of us is to have really good coping skills and really understand like what's worth stressing about.
Mm-hmm.
We
Mm-hmm.
don't need to go into fight or flight mode, certainly for, the smaller things, right?
I agree.
So for whatever reason, resume slideshow. Here we go. Okay. Ta-da.
Woohoo.
Okay. So those who serve passionately often go above and beyond to make sure the needs of their families, clients, and staff are taken care of. I could tell you this. I took a 10-minute break between my last 2 meetings, and my college-age student who is home in the house, I just made him breakfast and then ran back up here. So, those who are caregivers and those who are servant leaders love to care for others and love to serve. But if we overdo it, if we don't serve our needs first, the ultimate result is stress and anxiety. And stress and anxiety can result in an inflammatory response in the body, which causes a whole host of other issues. Going back a little earlier, I said, no sense getting yourself worked up and going into fight or flight mode over something that is trivial or you have no control over, because every time you elicit that response, your heart rate quickens and your blood pressure increases, and it's very taxing on your cardiovascular system and could lead to long-term health consequences. So stress management is a key element of personal care. Now, in addition to the risk to your own mental health and well-being, the culture of your workplace, your home, your employees will be impacted. It's interesting because my husband once said to me that my energy is so strong. And when I'm in a great mood and I'm feeling positive, I lift up the whole family. But if I go the other way and start, ruminating on negative energy, it kind of pulls everybody down too. And, all of these little things, these experiences in our life teaches us, how we influence others, Okay, stress. I think it's stress. I love this because lots of times, we get to a place or somebody finds themselves in a position where just they're not feeling right and they want to know what the cause of their problem is, and there must be a physical cause. I know it. I know it. And the doctor will say, well, it's related to stress. And oftentimes when somebody is told that they have an inflammatory disease or a disorder or a condition that's related to stress, it's almost like accusatory or blaming the patient for their own condition. And that's not always the case, because stress comes in many forms, whether it's physical, mental, emotional, environmental, anything that upsets the balance of homeostasis, which is the way things should be, right? The way our organs and our cells function and the way our bodies manage themselves automatically, intuitively. Anything that disrupts that process is a stressor. And of course, we know that there are positive stressors, because if you're going to either, run a race or leap to, get the child from flushing a slipper down the toilet bowl or whatever it is, you need to be on your toes and have some instinctive strength and speed. So there is some good stress, and that comes with exercise. But never blame yourself if you have a stress related disorder. You know, there are all it's really the root cause that you want to identify. So why is it that I react that way, and get to the bottom of the cause of what is manifesting itself as a stressful response or a physiological response. Some people get rashes, they lose their hair, they lose weight, they gain weight, they eat more, they're nervous, they get ticks. It goes on and on. But if we find a little time to kind of get back and step back behind the noise of our lives, we can find that place that we can retreat to when things get too chaotic. So your mood and your mental health affect every aspect of your life, from how you feel about yourself, right? If you're feeling crappy, if you're feeling stressed, if you're feeling not positive, that is going to be reflected in everything you do, right? Even in the workplace, right? What do they say? It's a colloquialism, you know what runs downhill, right? So, culture starts at the top. We're the leaders, and if we come in the door with a positive mindset and good energy or calm energy, even when you're dealing with children, right? Children are really intuitive, and they could sense when you're stressed and you're nervous, right? So the do as I do, not as I say, right? Not do as I say, not as I do. So we really should reflect on how our moods and our attitudes impact those around us. And if we're not in touch with ourselves, if we're not connected to our source of positivity and good energy, through prayer, meditation, higher power, self grounding, whatever it is that centers us, it will parlay itself into other areas of our lives. And we know that there is a good link between mental health and good physical health, and vice versa, right? So mental health, the whole destigmatized thing, and I'm just going to digress here because the Morris County Chamber of Commerce is working with the Mental Health Association of Essex and Morris counties, and they have an initiative called Team Destig, and they're going to be putting out mental health first aid workshops and more to come, webinars and events, to really help everybody to understand that it's okay to share if you're feeling anxious, if you're feeling depressed, if you're having mental health issues. You wouldn't hesitate to tell somebody you had an earache, you know? So when you get those mental health screenings at your annual physical exam, which I will get to, annual physical exams are so important. If you're having a mental health issue, a mental health emergency, it's so important to get attention. If you were having a heart attack, God forbid, I always preface that with God forbid, but you wouldn't hesitate to call 911. If there was any kind of emergency or catastrophic situation where you had to call the EMTs, call an ambulance, call the police, you would. So we strongly encourage people, if you're having any kind of mental health emergency and you feel helpless and hopeless, there is help available out there as well. It is really,
I'm Laura, I'm gonna jump in there if I can
please
too,
do.
because we have a mental health first aid, presentation later this month, just an introduction to, and I understand, you probably know more than I do, that it's nice that I think they're transitioning that mental health first aid, training to virtual, and that they've
Yeah,
recently done some updates. So I think
yes,
it's also helpful for us to know if we're witnessing something, what it might be that we're witnessing, and how best we might help that person until
yes,
help arrives, right? That's the
absolutely.
concept.
Absolutely. And there are also de-escalation techniques
Mhm,
that help you in all areas of your life,
mhm,
to
mhm.
help you, to help other people, even when you're having, children. I know you deal with a lot of children and families. This education for mental health can also help to de-escalate a child's tantrum,
Mhm,
and help a
mhm.
child calm down and redirect to their homework with all this virtual learning and schooling. There's just so much to it, but there is a link between mental health and physical health. And also, I don't want to get, I'm not a psychiatrist, and I don't play one on TV, and I don't play one here on Zoom either. But, you know, if a person is somatizing and, really feeling horrible and terrible, they will get a digestive disorder and they will
Mhm.
start getting aches and pains. Not to get too much on the esoteric side, but you block up your energy. And I'll throw some physiology in here, and that happens because you're tensing yourself up, and things need to flow freely through your body. Your blood and your oxygen need to flow freely, and your energy is really a result of your physical relaxation. So there's so much to it. And I encourage everybody, if there's anybody in your family, anybody that you know, um, mental health is available to all of us. And now, in the DSM, the statistics manual, your insurance company will pay for any mental health treatment and care. So trouble sleeping, lack of energy, heart disease, and other health issues. It's here on the slide. So here's something that's so important. Practice not doing, and everything will fall into place. I'm so busy. I'm so busy. I don't have time. One of my colleagues, back at a job where I was a wellness director for a large nonprofit, I was going through resumes, and I was looking at this one particular guy's resume, and I noticed that he was a yoga instructor. He taught meditation classes. He didn't necessarily have the health education class experience that I would have preferred at the time. But I just thought this would be a cool person to bring into the fold and bring on. And I did bring him on, and he became an amazing health educator and just continued in his education in mental health, working with people with mental illness. This person taught me a lot as a yoga practitioner. And I always like to give him a shout out because it's so well deserved. But he always would tell me when I got too busy to just sit and do nothing. And you'll find that if you do nothing for 5 minutes, you will do more with the rest of your day. You need to just step back, get behind all your work, and take a moment to just be and let everything go. So I encourage you all to, either put a visual aid in your room that has a comforting atmosphere, such as this. I call this the ocean of awareness. When I meditate, I like to pull the ocean up on the screen. The ocean is one of my favorite places in the world to just be and hear the noise of the waves. And you can find that you can tap into some sense memories, and this is not just a thing in acting. This is a real life thing. Imagine that you're sitting on the ocean and you could smell, back in the day when they called it suntan lotion instead of sunscreen, you can smell the suntan lotion. You could see the Coppertone banner ad airplane, coming along the shore. You could feel the sand with your fingers and your toes, and the heat of the sun and the breeze on the face. Hear the waves crashing at the shore. I bet if I came in and I took your blood pressure pre and post that 5-10 minute exercise, that your heart rate and your blood pressure would be lowered. Taking an image of something that brings you to a place of peace and helps you just step away from the chaos allows you, again, to get rid of that noise, right? That constant self-talk of, I have to do this, I have to do that. What did I forget to do? Half the time people, and even possibly now, I've done it, I go on to meetings and I've got something else going on the side. We owe it to ourselves to just take those moments and fully attend to the task, the matter, the moment at hand, right? The past is behind us, and the present is a gift, and the future is unknown. So when we get away from the past, away from the future, and into just being in the present moment and observing everything that's around us in the present moment, and really understanding, do I know what it feels like? Like, what is the surface that my feet rest on? Is the air cold or warm? You know, if we had one day left and we knew we had one day left on this earth, I bet we would be observant of every little bird chirp and breeze that comes through the window. It's so important for our health to really kind of stay in that pocket of being behind the daily to do and chatter. Because even when we sleep, our brains, we're thinking, we're dreaming. There's always something going on, you know? So again, I encourage you strongly to take time every day and meditate, reflect, pray, whatever it is that brings you peace. I do have a meditation, self-meditation guideline that I can share with you to distribute to everybody. It's
That
a
would be great.
step-by-step guide.
That would be great. And Laura, I recently read that meditation doesn't necessarily have to be when you're sitting still. Is that true? Like that you can, it's just even being out in nature, or it's just anything that helps you put life on in neutral for a minute. Is that true? Or would you agree with that?
I would agree with that. There's something called Zen walking, right?
Mm,
Where you just walk. And I try to do it too. Now I have a practice that and we're always working on our own practice. I'm always every day working on it. I stopped taking my phone out with me when I walk my dog. And I make my dog's walk about my dog, not about me getting exercise. And I find when I do that, when I just let the dog stop and sniff, think of what an instinctive creature an animal is, right? They're not on a schedule. So I just kind of follow my dog's lead and go with it. And it's a mindless adventure. It's really something that I do. So yes, you can be active. Runners, I used to pray. I used to tell somebody that I pray and she would make fun of me, but I would run 5 miles and use that as my prayer and reflection time. It also got me to the next mile, you know, but running, walking, physical activity, um, anything that you do that requires no thought is a group exercise class is not necessarily the same as going for a run by yourself or a walk by yourself or a bike ride by yourself. It's hard to be reflective in those environments. So solo activities or activities with others that are quiet. And I just saw something. I do Weight Watchers just to kind of keep my weight managed. And Oprah is now one of the owners of Weight Watchers, and they have all of these resources, and they have podcasts for when you go out walking and running that have positive messages. So I don't work for Weight Watchers; they don't pay me to plug them, but I'm just saying it's something that's out there. So listening to something positive, some good music, a lecture, a meditation. So again, going back to what you said, there are many ways to keep your mind and mood in optimal shape. Exercise, healthy eating, mindful eating. Now, I'm not coming from the perspective of an exercise and nutrition professional, which I am, but that's not the purpose of this. This is a holistic self-care approach, but I cannot underestimate the importance of regular exercise and a healthy diet that's balanced with nutrition, adequate hydration, void of sugars and processed foods. It's so important for not only for your genetic structure and cell replication and immune system. I mean, think about what makes a healthy body. If you want, just let's talk about skin. Let's talk about healthy aging. That's a good thing to talk about. If you want your skin to age in a healthy manner, do you think Doritos is going to help you get healthy skin cells over, a lean piece of, protein or some water-filled fruits and vegetables, right? Your organs, the tissue in your organs is replicated every minute of every day, and your tissue needs nutrition to adequately repair itself for optimal function, for beauty is skin deep. They say, well, healthy people look healthy, fit people look fit, people who eat well look like they eat well. And there's a reason for it, because what you put in your body has an outward manifestation. And when you treat your body well, it will also reflect in your mood, in the energy you put out into the world. And what's that old expression? You get more flies with honey, right? That's all about vibration and the kind of energy we put out into the world. Because if you go around, like a grouchy, grumpy, acerbic person, people are going to react accordingly. If you're nice and generous and open and sweet and friendly, people will react to you according to that as well. So how we treat ourselves has a large influence also on what kind of energy we put out. Stress reduction techniques I just spoke about. Routine healthcare, so important. All of the above keep your brain, your body in top shape. Routine healthcare is really so critical for improved health outcomes, and we're going to move on to that. It's important to see a doctor when you're sick. We know that, right? You have a flu. Now, every time somebody sneezes, we think we have COVID, and we run off and we get a COVID test, And there are a lot of people out there with COVID, and a lot of them are asymptomatic, So now in today's world, people are using standard precautions and hygienic practices and attending to symptoms in an unprecedented way. And we are hoping that, once COVID is under control, and it will be, right? We're moving in that direction, that people continue to wash their hands and take vitamin C and D3 and zinc and immune supplements and eat better and get regular exercise, knowing that if we become compromised, we are at a greater risk for the impacts of not just COVID-19, but any virus, any illness, right? Very important to call your doctor when you're sick and you're not feeling well. But you also should see your provider once a year, every year, so that you can participate in the exam. So I say so that you have the stamina to participate in the exam. When you're sick, and nowadays, if you have a sniffle, you have to wait in your car and they'll come out and examine you in the car, right? But let's just talk about in real time, traditionally, when you go to the doctor and you're not feeling well, the doctor squeezes you in, they see you, they look in your ear, they look in your throat, and they're troubleshooting, and they're focusing on your symptoms and diagnosing the cause of those symptoms and treating accordingly. But when you go for your routine physical, right, it's usually the doctor allocates an hour worth of his or her time, and it's either your doctor, a nurse practitioner, a physician's assistant, whomever your provider is in that office. They actually take the time and they do the mental health screening, and they ask you about your lifestyle, and they do a head to toe examination, and they order your labs. And it's an opportunity to counsel you on medication management, lifestyle management, any issues related to, well, in my case, I snore. Okay, there, it's out. I said it. Okay, so, I took my routine exam to talk about sleep apnea. I don't address it. I snore and I get woken up, in the middle of the night and told to be quiet. But all kidding aside, that is the opportunity to address these issues. See a cardiologist. I love to tell this story because it's so important. And I am a nurse. I could be online at a wedding and I will know somebody's bowel habits and sex life by the time we've gotten to the big CD, because people open up, and everything is always in the strictest of confidence. But as such, as a healthcare professional, I feel like I have a license to talk about whatever I want and put it in the context of healthcare. But I'll tell this story. I went for my annual gynecological exam and my annual physical exams a couple of months apart. I guess it was 3.5 years ago. And in both exams, there was blood in my urine. And both of my practitioners said, it's common, but it's not normal. Because I was like, but it's normal. And they were like, no, it's not normal. So let's follow up. So they followed up, and it was persistent. So they wanted me to get a bladder scan. So then I got a bladder scan, and they said, Very interesting. Your bladder's okay, but we noticed a little something on your kidney. Let's move up. Let's do an abdominal scan. So they did the abdominal scan, and my doctor called me and she said, "What are you doing?" I said, "Oh, I'm out jogging." She said, "Okay, so we did the bladder scan and then we moved up to the kidneys. There's a little something on your kidney, but it's nothing. It's a lipoma. It's a little fatty tissue. We'll follow up on it." I was like, "Oh, that's great." And she said, "Would you just let me talk?" I said, "All right, what?" She said, "You have a tumor on your heart." I was like, "What?" So it turned out it was a purely incidental finding. And you don't get incidental findings if you don't get regular exams. So it was a very scary thing. And there was a tumor the size of a golf ball. It was benign. It's gone. I'm fine. It was a benign tumor called a hamartoma, the size of a golf ball. And it was nestled on my left side in my lower left lung in the cardiac notch. And I went up to Morristown Hospital to, actually, it was the Carol Simon Cancer Center. And great surgeon, by the way, Dr. Widman, if you ever need a cardiothoracic surgeon. I don't work for him. Amazing. But they didn't know if it was on my heart or if it was on my lung. And the problem is, had it been on my heart, I could have gone into sudden cardiac arrest at any time, and I did not know it. And they did a PET scan, and then they said, "Okay, it's not on the heart, it's on the lung." So the doctor said, "You can keep jogging," because I did this cardiac conditioning thing up until the point of surgery. And then like 2 weeks after surgery, I started running again because, that was my lung. I lost a piece of my lung and I wanted to make sure I had my lung function. But the moral to the story is, had I not gone to the doctor in the first place, and no, there was no relation between the blood in the urine and the tumor at all. But it was just one of those, my mother always said, God writes straight with crooked lines, right? But it was just one of those situations where when you're having a physical and you get lab exams and you get urine specimens and you do blood tests, they can find and detect something before it gets bad, before it hurts you. Now, for something to be the size of a golf ball, and I had a chest x-ray, I don't know, when I was nursing and I had to get a TB test and all. So it had been about, 8 years between my chest x-rays. So somewhere in the last 8 years, this thing was growing, and we don't know what the pace was, but if it got any bigger, I could have just like dropped dead, and nobody would have known why until, I guess, they did an autopsy and said, "Why did she drop dead suddenly?" You know, um, I can't overemphasize how important it is to get routine health care, because you just never know if there's something there, and God forbid there's a cancer. They find it early when it's treatable or easier to treat. Thank God we've come a long way with treatment. But I like to share my personal anecdotal stories to help people understand that it's it's okay to be afraid, but don't be afraid to the point that you don't get your mammography and you don't get your exam, because that will have worse consequences in the end. So they are open for business. They might make you stand there and, scan you from head to toe and hyper sanitize and take your temperature, but screening centers are open for business. And I know a great secret, that Atlantic Health System has the Rockaway Pavilion, that if you feel like going up to the Carol Simon Cancer Center, it is too time consuming to get your mammography. The Rockaway Pavilion, you're in and out very quickly. So thought I'd share that one. So talk to your provider about what screenings are right for you, what your family health history is, what your personal history is, and then they will tell you what screenings you should get. whether it's a colonoscopy or a cervical cancer screening. It's really important that we're truthful with our providers, right? They are not in judgment of us. They are there to help us. So when you're having this relationship, really open up. If you've noticed that there was blood in your stool and you're embarrassed to talk about it, the doctor's office is the place to talk about it. Anything abnormal should get reported to your doctor, and then your doctor will recommend screenings. And I know the screening facilities had been backed up because the diagnostic facilities, a lot of them were only staying open for emergency care during COVID, but everybody is back in business. So if you put off your mammogram, or you put off your colonoscopy, or your prostate screening, or anything, reschedule it, please. So here are some tips. We have a daily checklist. Every day, ask yourself, did I eat at least 1 or 2 healthy meals? All right. I'm not going to tell you never have pizza. I'm not going to tell you never eat a Snickers bar for the rest of your life. But let's look at what we do most of the time, right? Have I had a healthy meal with a balance of fruits, vegetable, and lean protein? Now, vital signs and prescribed medications as directed, those are for people if you have high blood pressure and you have a home blood pressure machine, or you have diabetes and you're instructed to do home glucose testing. Do it. If your doctor says to do it, there's a reason for it. If your doctor says to check it daily, check it daily. And I hope this is stuff that you would impart on your mother, your father, your sister, your family member, the people you care for, that it's important to know what you're taking and why you're taking it, and to take it as directed. Take your vitamins and supplements as directed. Okay, I'm going to go on a little tangent. How are we for time?
You've got about just a little over 10 minutes.
Okay, we're good. I knew a person who was prescribed very strong antibiotics and was taking herbal supplements in addition to these antibiotics. And she went into liver failure
Yikes.
because she had Lyme disease, and she was self-treating herself for Lyme disease in addition to very strong antibiotics, which you may or may not know can be very toxic to the liver. The liver has the responsibility of metabolizing everything. And when you have pharmaceuticals and other substances, alcohol, it's very difficult to metabolize and could cause damage. This woman was taking lots of herbal supplements and didn't tell her doctor, and she almost died. And I was her advocate and was up at the hospital every day, and they hydrated her, and she had a miraculous recovery on Christmas Eve. So it's really, really important. If you're taking any supplements, tell your doctor, because it might interact with the medication, right? It might not be doing you any good. I went for years telling my doctor, I'm not going on cholesterol medication ever. I'm this holistic wellness person, and I'm not going on medication. So I was taking red rice yeast extract, and I didn't tell her, and she got really mad at me. Now, finally, after menopause, I realized that it's not my fault that my cholesterol's high. It's just one of those things, and I'm taking medication rather than trying to self-treat, because I trust my physician knows better than I do about these things. But you can always question, why am I taking this? Is there something I could do instead of this? And your doctor might say, yes, take this supplement instead of medication, but tell me about it. Check in with me. Take time to quiet the mind with reflection, deep breathing, meditation, and prayer. Set a positive intention for the day. Imagine waking up in the morning and saying, today is going to be a great day and something great is going to happen to me today. Imagine waking up with that expectation every day instead of saying, I hate Mondays, because if you hate Mondays, you're going to hate Monday for the whole day, right? Set a positive intention, or look at a goal that you have in your life and see what steps you can take to bring you 1 inch closer to your goal, right? Create some quiet time in preparation for 8-hour sleep at the end of the night. So you have a routine, maybe a hot shower, or you like to read a little bit, quiet the lights, and really calm yourself down so that when you do drift off into sleep, you have a restful sleep. Weekly, Weigh yourself once a week. Don't be obsessed like I am. Sometimes I weigh myself 3 times a day because I want to know how much that glass of water weighed. Seriously, no joke. But weigh yourself once a week, first thing in the morning, right? Exercise for a minimum of 30 minutes at least 3 times a week. There are more recommendations out there, but if you're doing a little checklist and you have more vigorous goals and you're working with a trainer or you have a bigger routine, but for those who don't exercise at all, make this your minimum, and I will guarantee you it is so contagious that once you start exercising, that 30 minutes may turn into an hour and a half. Monthly, women, please self-breast check. Even if you're fearful of finding something, better to find something and treat it than to not find something at all, right? And then review your fitness and nutrition routines. How many times did I exercise? Am I really getting enough water? Am I really eating enough fruits and vegetables? Annually, schedule an exam with your primary care provider. And according to your primary care provider's recommendations, schedule screenings and lab tests. So when they write that lab requisition and you go home and you put it on the refrigerator and it's sitting there 3 months later, get up, get yourself to a lab. And I know that's challenging for those who like to kickstart their morning with coffee because it has to be a fasting blood test. And then follow up, please. Don't assume that no news is good news. Most of the time it is, but there is such a thing as human error, and sometimes people forget to report results. And ask questions. Ask questions. You're the customer. It's your time at the doctor, right? So if you went to a restaurant and you said to the waiter, what's in the pasta puttanesca, and he refused to tell you, you would call the manager, right? Your doctor's the same way. Ask your doctor a question. They're not going to refuse. Doctors love when patients are responsible for their self-care. And if you have a physical or mental health emergency, call 911. Don't try to be a hero. Don't try to drive somebody to the hospital. If you think they're in a medical crisis, call 911. I urge you. And then last of all, mark your calendar. Mark your calendar. And if you cancel an appointment and need to reschedule it, reschedule it. Okay. So important. Get it on your calendar. I know sometimes we make appointments while we're driving in the car and we write it down, and then I'm really revealing a lot about myself, aren't I? And then we lose the piece of paper, and then we call the doctor again. And I know how frustrating it could be. Sometimes you go to a doctor's office or a diagnostic center, you're on the phone for a half hour before you could get the appointment, but just stick it out and get it done. And then I made this to share with everybody. No, not this. I made a self-care checklist to send to you if you wanted a copy of it. You make one of your own, or you can just, put this somewhere where you see it to make sure that you're, keeping up to your to-do list related to your self-help and your self-care.
That's terrific. Are we supposed to? I don't think my screen changed, Laura. Are you showing us something else?
Nope, I'm stopping share now. Well, I did show you my checklist.
Okay, great. That's okay. So we can share that with
I'll email it to
participants.
you.
And I just have a general question. Thank you so much that was a really comprehensive overview. And I think starting with the elephant in the room was a smart place to start, right?
Thank you.
Because my question for you is just making sure I understood what you had to say correctly is, I think a lot of us, myself included, have been white knuckling it just to get through the pandemic. And we're not thinking about regular care. We're worried about who's healthy, who's safe, that kind of thing. Is the place we start with our primary care, is that the first thing we should do, is schedule that annual appointment and then go from there as to what they recommend? Or if of a woman, is that the gynecology, is that on the same bullet point? Or what would your advice be? Because I think a lot of people have just, obviously, we're not focusing on self, I think.
Right. So that's a great question. First of all, the gynecologist kind of takes ownership of your personal health care too. My gynecologist asks me if I have had a colonoscopy and asks me those other questions. I would say your gynecologist, if you're a woman, and your primary physician are your partners in healthcare. So you should schedule both of equal importance, right?
Hmm.
Because there are other things, right? There, your gynecologist is focused on the reproductive system and that healthcare, but there could be other things that are going on with you. They will not run a complete blood, complete blood test or metabolic panel on you, but they are equally uh, important healthcare partners for women, in my opinion.
Hmm. Hmm. That's great. I see someone added there. Always get blood work done. That's a good tip, Lois. Right? You say,
Yes.
are there any other questions from the group? I think I really I love this topic so much, Laura, because like I said, I just think we're all vaccine oriented. We're all washing your hands. Like we're not thinking about the basics,
Yeah.
and I think a lot of basics have slid
Yeah.
to the wayside. Um, what's the biggest misunderstanding that you think that's out there? If there's something that you could clarify for the general public, I feel like people who aren't in healthcare sometimes miss the obvious. Is there any other nugget of recommendation that you would offer up?
Well, I, I I don't know if this is the obvious one, but the most important one for me is that this don't rely on your doctor to take care of your healthcare. We must rely on a healthcare. It's a complicated and tricky healthcare system. We know that. But your car dealer is not going to take your car for an oil change or change your tire. You will treat your body with as much love and care as you would treat any of your most treasured possession, because the most important possession you have is your body. And it is really up to each and every one of us to make sure that we
Mm.
provide ourselves with adequate health care.
Mm. I love that, Laura. That's really an excellent way to look at it. And I'm looking in the chat. I'm seeing we've got smiles. We've got people that were glad to be here today. And I just something coming in the chat. I gotta be quick here. Great presentation. You're getting a
Thank
thumbs
you.
up from
Thank you.
Charlene. You've got your fan club here.
Bye.
Thank you, Laura, so much. We will send out a copy of her presentation, which of course you feel free to share with anybody that you'd like to share with.
Yep.
Laura, I would love to get a Word document or a PDF of your checklist, because I would love
Yes,
to
I have
throw
it.
that out as well.
Okay.
And I just want to remind everybody that, Family Partners, we're all about empowering. And I think Laura gave a very empowering conversations today about how we can help ourselves. Because you know what, when you're in the position of leadership, when you're caring for others, be it your family, be it the folks that your organization serves, we really owe it to them as much as we owe it to ourselves to take care of us. As Laura said, whether the plane's going down or not, put that oxygen mask on yourself.
Yeah.
And, also remember, you're modeling healthy behavior. If you're taking care of yourself, then others around you understand that that's a priority as well. So it really is full circle all the way around. And the other thing to keep in mind, like I said, family partners, we're here every week having conversations about topics like this that are really important. And we also are proud to bring you support groups. Almost every night of the week, we've got them for moms, for dads, for youth ages 13 to 21. And we have support groups for Spanish speaking parents and using nurtured heart approach, positive parenting. And we're pleased to Krista give a wave. Our youth coach is on the line today, and Krista meets with youth on Friday nights, but we're very excited that she's launching a new straight from the heart, with ART capitalized, an art program for youth, which we hope to launch in February. So we're always looking for ways to connect folks to peers who are of similar minds and similar challenges. And we just hope that you check us out. If you haven't already, if you're not on our email list, please drop an email to me or put it in the chat. And the other thing too is we're being very courageous, aren't we, Krista? In the new year, we are, because in addition to the support groups, we are launching Facebook groups for the moms group, the Spanish group, and the dads group, so that the conversations can keep going between sessions. And our youth partnership is also launching something similar on Discord, which I understand is a platform that the young and hip are more on than Facebook. I see you laughing, Krista. You know that's the truth. Okay.
I'm
So
not young and hip though.
Oh, but you are, girlfriend. It's all relative, right, ladies? It's all relative. So I want to thank everybody for coming out today to our discussion. And Laura, thank you for putting together such a thoughtful, comprehensive pep talk, really, of how to take good care of ourselves, because it all starts with us, like it or not, right? It all starts
Yes,
with
it
us.
does.
So
Thank you. Thank you for
I
having
hope
me.
to see you folks in the future. Like I said, later this week we have I'm sorry, this month we have an introduction to mental health first aid, and we also have a presentation from the group in Sussex County that provides support to those who are struggling with domestic abuse. So thank you for coming out. Everybody stay healthy,
Thank you.
and
Thank
I hope
you.
to see you soon. Take care.
Well, thanks.
Bye
Bye-bye.
bye.
Bye.